Hello, welcome to Vail Valley Medical Center, also known to our staff as VVMC. My name is Doris Kirshner. I'm the President and CEO of the Medical Center and all of our facilities connected. I want to welcome you as new employees to our organization. It's a fabulous organization and you will become a vital part of our team. I would like to introduce you to our mission and our vision and our values that we hold dear at Vail Valley Medical Center. Our Vail Valley Medical Center vision is that we want to remain an independent 501c3 organization, which means we're not for profit. All of our dollars that we bring into this organization through our services and our service lines go back into the organization and into the community 100%. We want to remain independent. We also want to serve our local Eagle County residents in a high quality way. We want to serve our visitors, our destination orthopedic patients, and also our emergency patients and our cancer patients. We want to do this by partnering with you and with our physicians to provide the highest quality of care and the safest care that we can for our patients. Our mission is that Vail Valley Medical Center will provide superior health services with compassion and exceptional outcomes, and those outcomes will be measurable and based on evidence-based practice. Our value statement is very important. This statement was written 100% by your fellow employees over a 2-month period. The value statement clearly explains and exemplifies the kind of care, the compassion, the responsibility that we want to provide here. We also speak to our 6 peaks of excellence at Vail Valley Medical Center. We have the people peak, quality peak, also safety peak, then our service peak, and then our finance peak, and finally our growth peak. As you can see now, there are some folks who are members of the organization who would like to share with you some of the ways that they live and breathe our 6 peaks of excellence.
Just showing respect in today's world. That's what the People Peak is about, and making sure that people know that they're respected with thank yous and you are too, and that results will be produced.
People are a most important part of our organization in providing care and competencies and skill levels to meet the needs of our patients and our surgeons.
Quality at VVMC means making sure that the patient has the best experience possible in the hospital, and also making sure that we're looking after each other and taking care of each other as well.
Quality. To maintain quality, high standard, and to work through our lean projects, which are our process improvement projects that we work with on a team basis.
I think safety involves not only staff safety, but it's also patient safety. It's environmental safety, that just keeping in place, upkeep, keeping it clean.
Safety. Of utmost importance is patient safety, employee safety at Vail Valley Medical Center.
You really do just want to serve the patient. You want to serve the doctors that you work with. You want to serve the nurses, the techs, the front desk. I mean, when any of those pieces fall through, you're hurting.
Service peak. What do we give back to our organization? What do we do within our organization to support our community?
The employees who are recognized in the financial peak are those who are implementing cost-saving strategies to the institution, or those employees who are helping patients meet their financial needs with providing medications free of charge or services.
To provide that extraordinary care and high level of service, we need to maintain financial responsibility within the organization. So accountability and responsibility to our financials are of utmost importance.
It's taken a step in the direction of offering more products to the consumer, things that are nicer, friendlier, more comfortable. It's just a step in the right direction for our patient care.
How do we grow ourselves? How do we grow the organization? The growth peak is important to each one of you individually, as you have opportunity to attend classes provided by the Medical Center, and also to continue a higher level of organization through our human resources complements that we have to offer you.
Basically, it was a quality improvement project. We kind of had a discharge process that wasn't flowing very well, and it helped the nurses be able to spend more time with their patients, and it also helped the patients provide more education to the patients to help them know exactly what they were supposed to do when they were leaving the hospital. And I also initiated a discharge follow-up phone call program. So after the patients left the hospital, I would call them at home to check on them and make sure that everything was going well with them.
The reason that I was nominated for this peak was that I help our indigent and uninsured patients at the Shaw Regional Cancer Center obtain medications that they would otherwise have to pay out of pocket, or we would as an organization have to absorb those costs. So in 2010, I saved about $200,000 or provided medications for patients that may not have been able to be treated.
I started a PIC program. It's a advanced catheter that I place. We didn't have anyone with the ability to place that catheter here for the last few years, so I came in and started a program, started putting in these PIC lines, and it's a lot more comfortable for the patients than some of the central lines that we have been using.
When somebody does a good job recognizing that, you know, even if it's a part of their quote-unquote their job description, being able to tell them, wow, you did really great, that was awesome.
There's so many people out there that they always go above and beyond, so I think it's really important for peers to recognize each other.
And it feels great to be recognized for that.
And even if you don't win, just being nominated is, you know, a huge good feeling, and so it makes all the hard work that you put in worth it.
Bringing something new to the table, it is nice to be recognized, of course.
You know, we just want to bring smiles to everyone's faces.
It seems like it's just part of what I do, you know, and I never really thought about being nominated or having that highlighted, so I was kind of embarrassed at first, and my husband's like, don't be embarrassed, just you should be thankful that your colleagues recognize the hard work that you do, and so he was absolutely right.